Hi, I'm Brian Finestein, CEO of St. Clair's Health, and we're here to talk Let's Talk Health with Dr. Rashida Sina, who's our Chief of Neurosurgery here at St. Clair's. And many of our listeners, Dr. Sina, are concerned about lower back pain. So can you talk a little bit about that for us?
Thank you, Brian, for having me. Yes, low back pain is a major problem, and a lot of people have a lot of questions about it. We can start by defining what is low back pain. Low back pain is any activity intolerance due to back symptoms. These back symptoms, they can include can be pain from an area of the truncal area all the way to the low back, which is the buttock area, including sometimes that pain can be from the back area all the way down to the leg area. And the back pain, we call it sometimes lumbago, and sometimes the other pain that it travels down the leg, we call it sciatica. Okay. Lumbago is an old non-medical term that it describes the back pain in the truncal area. Sciatica, which is referred to the sciatic nerve, which is the longest nerve in our body. This nerve comes from the nerves that travels from the lumbar to the sacrum. They come in and join each other and make a big nerve that travels through the sciatic foramen and goes down behind the leg on the buttock area and distribute along the lower extremity. Any pain along that nerve, it's called sciatica.
Now, how about, you mentioned lumbago. What's generally the cause behind that, though?
Well, the cause behind that can be from many things. So if we think about where is that low back pain or lumbago come from, we can think about the area where it's come from. And we looking at many things that can be in that area. First, we can go from outside to inside. As you can see here, we have the visceral area, the belly area, that can be deferred as back pain. And also we have the spine, which can give you back pain, and measure or anatomy in the spine that can give you that. So if we go from the back all the way to the front, with the pain can come from the muscles itself. It can come from the ligaments along the bones. It can come from the disc. It can come from the joints in the back, and it can come also from the nerves that in that area.
Are there any particular activities that may be a trigger for that?
Well, back pain can be acute, sudden, without any precipitating events, and back pain can be chronic. In general, 60 to 90% of the adults will experience back pain in one time in their life. Luckily, 90% of these back pains are temporary, and they will subside within 4 to 6 weeks. 7% of them probably can be chronic, can become a long-term or throughout life. The acute episodes that we talk about can last 4 to 6 weeks.
Those patients who have back problems, can you talk more about the symptoms behind it?
Yes. So the symptoms, we talk about back pain, which is the pain between the thorax and the buttock area on the pain that goes down to the legs. And that pain could be coming from multiple areas, and the patient can experience it differently and dependent on what's affected. So if we look at our model here, and we have basically this is the front, the belly is here, this is the back, and we have muscles. Basically, if the patient have muscle strain, he will experience some muscle spasm, and if he has other problems in the muscle, like, for example, an infection, he will experience pain as well in that area. And usually that pain is local, and a patient will experience pain on palpitation. If the pain is coming from disruption of the ligaments, the pain also going to be local. It's going to be painful to the touch. patient can experience pain that is coming from a disc. If the disc is herniated, it's going to push on the nerve. That nerve will basically, patient will experience back pain locally, but also will experience pain that is traveling along that nerve. And when the pain travels along the nerves, depending how the nerve is affected, is it the sensory part of it, is it the motor part of it, or is it the autonomic nervous system part of it, of that nerve that is affected? If the sensory part of it is affected, the patient will experience pain, paresthesia, numbness. If the motor part of the nerve is affected, the patient will experience, in addition to the pain, the paresthesia, and the numbness, they experience some weakness. If that's prolonged, he will experience wasting of the muscles and also weakness of that muscle. If the autonomic nervous system is affected, that's when we start talking about the cauda equina that we talked about earlier, which is basically the anesthesia around the genital area and incontinence either of the bowel or the bladder.
Well, are there any age groups that it's predominant? I mean, it's a lot of patients you've identified, but if we narrowed it down, can we get an age group?
That number that I gave, which is 60 to 90%, will mostly affect the age bracket between 35 and 55, and these are the most prone to having back pain. When these back pains, sometimes they can become, like I said, chronic, or they can become, they can be just acute, and they disappear in 4 to 6 weeks. Some people, 80 to 90% of these people that experience some back pain at one time in their life, they can have these frequent episodes. But luckily, even these frequent episodes, they can subside also within 4 to 6 weeks. 20% of these people may experience chronic pain and become throughout life.
Okay. Is it more predominant male, female, or?
It is actually equal in male and female. There is no predominance.
Okay. So people are experiencing pain. I assume they're self-prescribing and they'll take aspirin, Aleve, etc. When is it time to seek professional consultation?
So basically, as we said, that most back pains are self-limiting, and usually the best treatment first is conservative, and the patient will do that conservative treatment on their own. Some people will do some bed rest for a couple days, then they will reach out to the over-the-counter medication, non-steroidal like ibuprofen or Aleve. And at that point, the pain should go away, or at least subside a little bit, and the patient start tolerating some of their daily life activities. If that pain does not subside at that time, and I think it's time for them to seek at least their primary care physician, which will at least start some pharmacological treatment like muscle relaxant or and stronger and non-steroidal anti-inflammatory medication, and they may prescribe also some physical therapy. That being said, all these conservative treatments, they can be initiated unless there is what's called red flags. And these red flags can be, first, they can be suggestive, for example, of cancer. And some of these red flags could be history of cancer or unexplained weight loss, back pain in the age bracket below 20 years old or above 55. These red flags could also be indicative of infection, and in patients that, for example, had a UTI or had a recent bacterial infection, then they develop back pain. They should seek medical advice right away. People with immunocompromised, like on immunotherapy for transplant or HIV, or using a long-term steroids that makes them immunocompromised, if they have back pain, they should seek medical advice because that could be an indicative of infection. Sometimes red flags as indicative of trauma, which is basically a minor trauma that can give you a low back pain. That could be in a case of osteoporotic patient or a patient with a long-term use of corticosteroids, that can be an indicative of a fracture. Also, one of the major red flags is if the patient develop any subtle anesthesia, which is we describe our anesthesia in the private area, or any symptoms of incontinence, be it urinary or fecal incontinence, those are major red flags. Also, some major red flags are muscle weakness. Those all patient need to seek medical advice right away.
So let me ask you, sort of backtracking a little bit. So I have pain in my lower back. Typically, what type of diagnostic studies does a physician look for?
So after the first thing, which is if there is no red flags, then we went through a conservative management, including physical therapy, pharmacological treatment, muscle relaxant, and NSAIDs. I think that at that moment, either the primary care physician can initiate imaging, and the best imaging for a low back is an MRI, because an MRI can show muscle, can show nerve compressions, and can show other things. Sometimes the primary care physician can initiate some of the imaging just by getting an X-ray. An X-ray is only good for any dislocations or any fracture, but the main imaging modality for persistent low back pain that is resistant to conservative management is an MRI without contrast.
Okay. Now again, I'm coming back to, I have pain, I'm going to my primary care physician, or I'm handling it over the counter myself. Again, how long should I give myself to start feeling relief before I should seek more intensive care?
Acute episodes usually subside within 4 to 6 weeks. If you add conservative management to this, usually we advise patients to seek professional subspecialty help when they been treated at least for 8 to 12 weeks with physical therapy and medication. So they can seek either get an MRI with the primary care physician or have the primary care physician refer them to a subspecialist like a neurosurgeon to get the MRI and assess their pathology.
I want to come back to the red flags. I think it would be a good idea if you, again, highlighted when not to let it go and start treating yourself over the counter or waiting. So could you reiterate those for us?
Well, red flags, the first one that we are always concerned about is cancer. So if you have any unexplained weight loss, if you have if you are history of cancer anywhere in your body, or you have a lot of pain at night, those are red flag that may be indicative of malignancy. There is also a red flag that could be indicative of an infection. So if you are immunocompromised either by taking a lot of steroids, or you're taking immunotherapy for transplant, or you have immunotherapy for HIV, or you have a recent infection, those are indicative of, you have back pain, those are indicative of possible infection. Sometimes some patients also that went through the treatment of physical therapy and those prescribed what's called epidural steroid injections. If you got an epidural steroid injection and you start having back pain more than you started with, sometimes that could be also an indicative of an infection introduced during that procedure. There is some red flags indicative of fractures. If you have osteoporosis, or you have a chronic history use of steroids, and you had a minor trauma, then you have major back pain, that sometimes could be indicative of a fracture. The major red flags that we always have to tell the patient you need to go directly to an emergency room is when you have what's called cauda equina, which is basically compression of the nerve in the lumbar spine, and that can cause subtle anesthesia, which is a loss of feeling in the genital area, loss of control over your bladder or bowel. That control over the bladder could be either increased frequency, hesitance, or incontinence. Those are major red flags. The other major red flags is loss of power, which it could be foot drop, which is you can't bring your foot up, and that also be a red flag that you need to take yourself to the emergency room to seek medical advice.
Dr. Sina, are there any preventive measures people can take to avoid or minimize the back pain?
Yes, of course. That goes into the conservative treatment, but it is as a prevention. So prevention starts, for example, by weight loss, smoking cessation, also exercise that strengthens the core muscles of the lumbar spine. These exercises can be tailored to the patient themselves. Some patients will respond to, for example, Pilates. Some patients will respond very well to yoga. These are things that the patient should go and start, and if their pain gets better, they should continue. If their pain gets worse, they should seek other alternative of exercise. One of the most important things besides strengthening the core muscles is posture. So you can strengthen your core muscles, but if on a daily basis your posture is not the right posture, you're basically losing whatever you gain on strengthening those core muscles through exercise.
Okay, Dr. Asina, thank you. I appreciate everybody watching Let's Talk Health. I think the information on lower back pain is incredibly important to our population, and again, look for you to be aware of the signs and symptoms and next steps. Please look for future episodes of Let's Talk Health. You can follow us on YouTube and on Facebook, and again, for more information on our website, stclairs.com.